Hello, I am Dr. Manjiri Valsangkar, Director, Bhide Hospital Test Tube Baby Center, Navi Peth, Pune. Today, we are going to talk about a very interesting topic in test tube baby technology, which is not related to patients who immediately want a child, but who are actually suffering or diagnosed with cancers. It may sound extremely weird to you that a test tube baby specialist needs to be seen in a cancer patient, but then we know that around 3% of the population of cancer patients is still in their reproductive age group between 20 to 40 years of age, and many of them are not yet married, or many of them are married but yet to bear a child. Whenever they are diagnosed with cancer in the reproductive age groups, commonest being the breast cancer or leukemias or the blood cancer, it's but natural that the couple is aghast by the diagnosis of cancer. However, whenever they intend to have a child later, before this, the cancer has to be cured. The cancer cure is suggested by the oncologist, and most of the times it is followed by a chemotherapy. The chemotherapy are extremely strong and very effective drugs which are capable enough to abolish the cancer cells. Apart from the cancer cells, they, however, as a byproduct also act on the eggs, and hence the egg reserve or egg quality of the patient's post chemotherapy is reduced to nil. So, if a patient of reproductive age group is diagnosed with cancer, her oncologist at times before starting chemotherapy sends her to us, that is IVF specialist team. What is done in these patients is, before starting chemotherapy, her eggs are grown with the help of test tube baby technology. The eggs are taken out, that is retrieved, and these eggs are frozen by a technology which is known as vitrification for 2 years, 5 years, or sometimes even 10 years. Now, once the eggs are preserved, the patient starts her chemotherapy for the cancer treatment, which may continue sometimes even for a year's time or so. Once this patient is declared to be cancer free, then she can very well utilize these frozen eggs to make her own biological child that time. If a married patient already is suffering from cancer and needs to be posted for chemotherapy, such patients, without wasting time, can be started for a test tube baby cycle immediately, and instead of storing the eggs are taken out. That time the husband's sperm are used and the baby is stored, so which can be transferred at a later date once the baby's mother is absolutely cancer free. So my friends, if you are diagnosed with an unfortunate disease like cancer, do not get disheartened. If you are in your reproductive age group, talk to your oncologist, talk to your IVF specialist regarding storing of your eggs or storing of your sperms, so as to be able to give your own biological child after being cancer free. Thank you.